I wanted to remark on one thing, and it was just the sort of impressive range of different approaches in the vascular space. So I'm sure you'll have heard of aducanumab, the antibody that has been licensed for the AD pathology process. And who knows where that will go. In a few years' time, I think we'll know. But whatever happens with aducanumab, there's clearly enormous potential for medication around the vascular space. So I want to highlight from the conference the talk that my friend and colleague Terry Quinn gave around repurposing of existing drugs. I think that's a hugely promising area. Marion Buckwalter from UCSF talked about the immune cells that get into brain tissue in stroke and how they can contribute to the harm and possibly also be part of the solution. But then I was most struck by the overview that Jeff Williamson gave. Jeff Williamson was the lead PI on the Sprint Mind study that got quite a lot of traction a couple of years ago. And basically what Sprint Mind showed was a clear, significant reduction in some cognitive impairment endpoints in older people who were treated with an intensive blood pressure lowering target, aiming for a systolic blood pressure of 120 rather than the standard of 140. And what Jeff Williamson pointed out was that trial was stopped early. It was meant to go for 5 years treatment. In fact, they stopped at 3.5 years just because the intervention was clearly being so effective in reducing general cardiovascular disease and cardiovascular death, the sort of heart attack, heart failure, stroke, major morbidities. Now, if it had gone to its full 5 years, what would we have seen? Would we have seen that the very unambivalent change in dementia diagnosis? My hunch is that we probably would. And the message that I took away from that was that if Sprint Mind was done again and went to 5 years, I think we'd have very clear and undeniable evidence of a treatment that really moves the dial on dementia diagnosis. So that was like the highlight for me.